Welcome back to News 9 on a Monday. You know, navigating the gray area as we come out of a pandemic. Then there's talk we've entered an endemic. It can be confusing, and really, I think we can all relate to this one.
Right now, there is a slight uptick in BA2 subvariant cases of COVID across the U.S. Joining us is OU Health's Chief COVID Officer, Dr. Dale Bratzler. Thank you for talking to us. I thought we were done talking about COVID. Doc, what's the deal?
Yeah, I wish we were. You know, in the United States, we've seen a 38% increase in new cases reported daily over the past 2 weeks. And it's not evenly distributed around the country. I think most people are aware that the northeastern part of the country, Vermont, New Hampshire, Rhode Island, New York, they're seeing the greatest increase in new cases. Washington, D.C., 141% increase in new cases per day over the past 2 weeks. So we're not done with Omicron or COVID-19 yet.
Yeah, what about Oklahoma, Doc?
Yeah, Oklahoma's doing really well right now. Our case counts are quite low. We're at about 6 cases per 100,000 per day. And we know that the official counts underestimate the true number of cases in the state because people are doing home tests, and many of the hospitals now are not routinely testing everybody. So the amount of tests has gone down a lot also. But right now, Oklahoma appears to be in pretty good shape.
Do you think it'll kind of happen like it did last time? We'll just see it move this way? Is that what you're anticipating? And what do you tell parents about with their kids and getting a booster shot?
Yeah, so anyone who has not had at least one booster shot, I would strongly encourage them to get at least that first booster shot, because there's really good data now that not only does it protect you from getting infected, but it also protects you additionally from the complications of COVID-19. As you know, we now have a second booster dose recommended for people 50 and over, particularly those with immunosuppressed conditions and others. They should get the second booster, which again has been shown to reduce the number of actual infections. And to your point, I think most of our models still show that we will likely see some gradual uptick in cases in Oklahoma as it moves from the coast in to the Midwestern United States.
And Doctor, I thought the warmer months were supposed to be slightly better for not letting the virus get out of control. Talk to us about that.
Yeah, well, certainly that is the case. You know, we've seen in parts of the country some super spreader events where a single individual, some people, when they get this infection, seem to spread a lot of virus. And there have been super spreader events where multiple people have gotten infected. Summer outdoor activities generally much safer. I don't expect to see a big spike in COVID cases over the summer here in Oklahoma, but I do think we need to watch very carefully in the fall when we get to flu season again.
And real quickly about this subvariant, because it seems like with Omicron, it was more contagious, but the symptoms weren't as strong. Is that what you're seeing with this variant?
Yes, that is correct. And now realize there are 2 subvariants of BA.2 that have been identified in the northeastern United States, which may be driving part of the surge in numbers in the Northeast.
Goodness.
All right. Dr. Bratzler, thanks, we think.
Always great talking to you, Doc. We appreciate it.
All right, thank you.
You bet.